Hello, I'm Dr. Sachin Kulkarni, and I'll be just discussing the problems of women, or what tests commonly a lady should do after the age of 35, or a middle-aged lady, we can say, somebody who is beyond 30 years of age. I think she definitely needs to be in the best of the health, and that is easily achievable by a proper diet pattern, which is low in carbohydrates, high in proteins. And in proteins, soybean is one good substantial protein a lady can go into habit of having, because soybean not only gives you protein, but also gives you a lot of isoflavones, which keep your womanhood very good, and they are natural estrogens for your supplements. When your estrogens are going to come down as you grow older and older, these are the natural sources of estrogen, no side effects, and will keep you estrogenically more and more healthy. The second is going to be investigating whether you are suffering from any breast elements. So do learn self breast palpation, which is to be done with the flat of the palm, rubbing the breast tissue on the chest wall. And you can go to any YouTube videos or any information, a lot of that is on the Google. You can know how to do a self breast examination, which you should be doing to find out any lumps in the breast. You can also do a mammography once a year. That can be done on your birthdays. Husbands can gift a mammography to their wives on their birthdays, and that will be one good test to rule out any breast problem. You can do pap smears. There is something called liquid cytology, which is available, or HPV DNA cytology of the cervix, which can be done every 3 years, and that will tell you whether you are at risk of developing any cervical problems. If HPV DNA comes negative, practically you're not going to have any suffering because of cervical problems in your life. Which women should be careful? The women whose families are having history of adenocarcinomas, so carcinoma of breast, carcinoma of colon, ovarian malignancies. These are the women whose family members, like their mothers or maushis or aunts, are suffering from this. They should be more careful about getting these things tested. Obviously, a profile of blood tests should be done, like knowing your thyroid levels, doing your HbA1c, that is glycosylated hemoglobin, taking care of your hemoglobin levels, that you should be doing. And you should be also assessing your metabolic profile, and that's by doing lipid profile, taking your systolic or diastolic blood pressure, knowing your fasting sugar, and that will give you an overall picture about your health in your best format, so that you can take a call further. And obviously lifestyle management is the most important, but a periodic testing of these things would help you in a long way to go. Thank you.